I have a question about slide number 6. And the right hand, you refer Phase 3B, September the 13th, to current. In order to understand what's been going on, is it, in shorthand terms, reasonable to see that September the 13th data from then on as the second wave? And if so, when would you expect to see the curves on the right hand bend as a result of the measures you announced on October the 26th and November the 7th?
Sure, and that's a really good question. What we've called these phases is around the different testing strategies that we've had. So phase 3B really refers to when we modified the testing strategy for students in the school setting, where we said that that having a single symptom in a child doesn't necessarily mean that they need to go for testing. So that's our epidemiologic way of classifying these phases. I really feel that, as I said, our second wave, we had a gradual increase over late August into September, and really it was controllable. We were on top of it from a public health perspective. So I'm not sure waves are the right way to describe this, and I've said that before, but we did have this gradual increase that we were managing. Where my concern has come has really been in the last 2 weeks, really since the Thanksgiving weekend, I guess. So the impact of the Thanksgiving weekend, we started to see a week later some rapidly increasing rates. And this is reflected in what we call epidemiologic week 42, 43, 44. So it really has been the last 2 to 3 weeks where I would say we're in a place where we needed to take additional measures because we're starting to lose control of our ability to manage every case in a timely way. And so this means that people may be getting notifications. We now have a much faster way of texting people if their test comes back positive. And the importance for people who meet the testing criteria and have symptoms that could be COVID, that you must self-isolate until you get your test results back. And we're getting those test results back to people quickly, but that also means that it may take a day or 24 to 48 hours before public health gets that information and follows up with you. We're at that point right now where we all need to take a bit of responsibility for bending this curve back down, and we in public health are doing our best to try and support you in doing that. So yes, we need to take action now. I don't expect, what we're seeing today and yesterday, numbers that make me slightly anxious, those reflect exposures that happened a week ago. So I don't expect to see much change until maybe Monday, Tuesday, into next week. That's when we're going to start to see if we are taking the steps that we need to bend that curve back down.
Do you have a follow-up, Vaughn?
Yeah, I'm wondering on a more philosophical basis, do you think that the British Columbia's slow response, slow willingness to listen to what you've been saying for weeks, is one of the factors in all that we had this notion here that we were doing so much better than everywhere else, that it's taken us a while to notice that the trend lines are headed in the wrong way? And I don't mean your office, I mean just the general British Columbia public.
It's hard to know. I think we were able to do a lot this past summer, and I look at across the country, I look at other countries, Italy, Sweden. We all felt that we had the ability to manage, but if nothing else, this reminds us that humility is important in dealing with this. We're learning new things about this virus all the time. We know some things that absolutely do work, but the fact that it is rapidly taking off at this time of year in the Northern Hemisphere around the world reflects a couple of things. One, that it is circulating in our community, and there's a number of things that we were doing that are no longer as effective as they need to be as rates go up. And the weather, the climate, the cold, the conditions. We have more evidence that's coming out of labs as well as natural experiments around the world that it is transmitted more easily at this time of year. There's a seasonality to it that is unfortunate, but we have to live with that. And that means that we need to take a step back and put in additional safety measures and go back to retreating a little bit in terms of particularly our social interactions. I mean, I will say those places, some settings are still working really well. When we have appropriate precautions in place and people are taking them and using them, and that's one of the reasons why I have been emphasizing now how much more important it is now that we have higher rates and we're in this season to add that extra layer of protection, that the Swiss cheese model, and we've been talking about how to but each layer does its bit. And right now, wearing a mask when we're in public places, when we're around people we don't know, that's incredibly important, is that extra layer of protection, because we don't know everything about this virus yet, and every day we're learning more.
Hi, Dr. Henry. I wanted to ask you about how the modeling today that you have shared with us, how are we supposed to make that impact our lives over the next few weeks and months? Because we've repeatedly been warned that this was coming, that behavior needed to change, and the behavior has not improved as far as we've seen.
Yeah, I wouldn't say that behavior has not improved. What we saw was a decreasing in our curve, and then in the last couple of weeks, a rapid increase. So this is a visual representation of that. We've been following this from the very beginning, and we know that we can make a difference. So behavior has started to change. We've started to see, and I talked to the people who work on the front lines in contact tracing, and the settings that we're seeing the cases are ones that were social interactions last week. So we're now starting to see new cases having different issues. So, we're monitoring that. What's happening right now is a reflection of the last week to 10 days. What will tell us is what we're going to be seeing next week. It's a very challenging thing with this virus, with a 2-week incubation period. We're always a little bit playing catch up, but I want people to see today that this is not just in one area. This is across the province, but we know we can make a difference. And what we've given is direction about how to do that.